Are you putting your health at risk by living in one of these states? You won't believe the shocking truth about healthcare in these 12 states. Your well-being could be at stake. Hey everyone, welcome back to the channel. If you're new here, make sure to hit that subscribe button and ring the bell so you never miss out on our latest videos about important life issues. Today, we're diving into a topic that could literally be a matter of life and death: the states with the worst healthcare systems in America. This is information you need to know, so stay tuned till the end. Healthcare is a fundamental part of our lives, something we often take for granted until we desperately need it. Whether it's routine checkups, emergency services, or chronic condition management, the quality of healthcare can vary drastically depending on where you live. In the United States, healthcare systems are managed at the state level, leading to significant differences in the quality and accessibility of care. Factors such as insurance coverage, hospital performance, availability of medical professionals, and public health funding all play a role in shaping the healthcare landscape. Unfortunately, not all states are created equal when it comes to healthcare. Some states struggle with underfunded systems, lack of medical personnel, and poor health outcomes for their residents. These issues can lead to longer wait times, inadequate treatment, and ultimately, worse health outcomes. In this video, we're going to explore the top 12 states with the worst healthcare systems. We'll look at the data, understand the reasons behind these rankings, and discuss what this means for the residents of these states. If you or someone you know lives in one of these states, it's crucial to be aware of the challenges and consider your options. Let's get started with our list. These states have been identified based on multiple factors, including healthcare access, quality of care, and public health metrics. 1. Mississippi. Mississippi consistently ranks at the bottom of healthcare lists. And the reasons are multifaceted. The state struggles with high rates of chronic diseases such as diabetes, heart disease, and obesity, which are exacerbated by limited access to quality healthcare services. Rural areas in particular suffer from a severe shortage of healthcare professionals, meaning many residents have to travel long distances to receive care. Additionally, Mississippi's hospital infrastructure is often outdated and underfunded, leading to longer wait times and subpar patient outcomes. The lack of preventive care and health education further compounds these issues, creating a cycle of poor health that is difficult to break. 2. Arkansas. Arkansas faces significant healthcare challenges, starting with its high obesity rates and prevalence of chronic conditions like hypertension and diabetes. Many residents, especially in rural areas, find it difficult to access healthcare providers, with some having to drive hours to see a doctor. Public health funding in Arkansas is inadequate, which means that many essential services are either limited or unavailable. The state also struggles with high rates of smoking and low levels of physical activity, contributing to its overall poor health outcomes. These factors combine to create a healthcare system that is unable to meet the needs of its population effectively. 3. Louisiana. Louisiana's healthcare system is plagued by high uninsured rates and poor health outcomes. The state has some of the highest rates of infant mortality and maternal death in the country, indicative of systemic issues within its healthcare infrastructure. Chronic diseases such as diabetes and heart disease are widespread, and the state's public health initiatives are often underfunded and insufficient. Additionally, Louisiana faces a significant shortage of healthcare professionals, particularly in rural and underserved urban areas, leading to long wait times and inadequate care for many residents. 4. Oklahoma. Oklahoma struggles with substantial challenges in both mental health services and primary care access. The state has high rates of smoking and obesity, which contribute to its poor health rankings and put a strain on the healthcare system. Mental health resources are particularly scarce, leading to high rates of untreated mental health conditions. Access to healthcare providers is limited, especially in rural areas, which exacerbates health disparities and leads to poorer health outcomes. Oklahoma's public health funding is also lacking, resulting in fewer community health programs and preventive care initiatives. 5. Alabama. Alabama has some of the highest rates of preventable hospitalizations in the country, indicating significant gaps in primary and preventive care. Chronic diseases like diabetes and heart disease are prevalent, and the state also has high rates of obesity and smoking. Mental health resources are notably lacking, with many residents unable to access the care they need. Additionally, rural areas in Alabama face severe shortages of healthcare providers, which means that many residents go without necessary medical attention. These issues are compounded by underfunded public health programs and a healthcare infrastructure that struggles to meet the demands of its population. 6. West Virginia. West Virginia has one of the highest rates of drug overdoses in the country, a stark indicator of its struggling healthcare system. The state also battles high rates of obesity, smoking, and chronic diseases such as diabetes and hypertension. Rural areas are particularly hard hit, with many residents having limited access to healthcare facilities and professionals. The state's healthcare infrastructure is outdated and underfunded, leading to long wait times and inadequate care. Public health initiatives are often insufficient, failing to address the root causes of poor health and contributing to ongoing health crises. 7. South Carolina. South Carolina's healthcare system is characterized by limited access to care, particularly in rural areas where medical facilities and providers are scarce. The state also has high rates of chronic diseases and preventable hospitalizations, indicating gaps in primary and preventive care. Public health funding is insufficient, leading to a lack of essential services and community health programs. Additionally, health disparities are significant, with low-income and minority populations often facing the greatest challenges in accessing quality care. These factors combine to create a healthcare system that struggles to meet the needs of its residents. 8. Georgia. Georgia faces a high uninsured rate and significant disparities in healthcare access, particularly in rural areas where hospitals are closing at alarming rates. This leaves many residents without nearby medical facilities and forces them to travel long distances for care. Chronic diseases like diabetes and heart disease are prevalent, and the state struggles with high rates of infant mortality and maternal death. Public health funding is inadequate, resulting in fewer community health programs and preventive care initiatives. The combination of these factors leads to poor health outcomes for many Georgians. 9. Texas. Texas has the highest uninsured rate in the nation, which significantly impacts the overall quality of its healthcare system. Many residents, especially those in low-income and rural areas, struggle to access necessary medical services. The state also faces challenges with high rates of chronic diseases and preventable hospitalizations. Public health funding is insufficient, leading to a lack of essential services and programs. Additionally, health disparities are pronounced, with minority and underserved populations often facing the greatest barriers to care. These issues contribute to Texas's poor health rankings and outcomes. 10. Missouri. Missouri's healthcare system is challenged by high rates of chronic diseases such as diabetes and heart disease, as well as a lack of mental health resources. Many residents, particularly in rural areas, have limited access to healthcare providers, leading to long wait times and inadequate care. The state's public health funding is insufficient, resulting in fewer community health programs and preventive care initiatives. Health disparities are also significant, with low-income and minority populations often facing the greatest challenges in accessing quality care. These factors contribute to Missouri's poor health rankings and outcomes. 11. Kentucky. Kentucky has high rates of smoking, obesity, and other chronic conditions, which put a significant strain on its healthcare system. The state also struggles with high rates of preventable hospitalizations and poor health outcomes. Public health funding is inadequate, leading to a lack of essential services and community health programs. Many residents, particularly in rural areas, have limited access to healthcare providers, resulting in long wait times and inadequate care. These issues are compounded by a shortage of healthcare professionals and underfunded healthcare infrastructure, creating significant challenges for Kentucky's healthcare system. 12. Tennessee. Tennessee's healthcare system is marked by high rates of uninsured residents and preventable hospitalizations. The state also faces significant challenges with mental health services, with many residents unable to access the care they need. Chronic diseases such as diabetes and heart disease are prevalent, and public health funding is insufficient, leading to a lack of essential services and programs. Additionally, rural areas in Tennessee struggle with limited access to healthcare providers, which exacerbates health disparities and leads to poorer health outcomes. These factors contribute to Tennessee's poor health rankings and the overall challenges facing its healthcare system. And there you have it, the top 12 states with the worst healthcare systems. It's alarming to see how many states struggle to provide adequate healthcare for their residents. If you live in one of these states, it's important to be aware of these issues and take steps to advocate for better healthcare policies. If you found this video informative, please give it a thumbs up, share it with your friends and family. And don't forget to subscribe to channel for more eye-opening content. Also, let us know in the comments below which state you live in and what your experiences with the healthcare system have been. Your stories matter, and together, we can push for change. Thanks for watching, and we'll see you in the next video. Stay healthy, everyone.